What are the key challenges in the management and treatment of MRSA?
I think the key challenges in the management of MRSA, to me, are distinguished depending on whether we're talking skin infections or more invasive infections. The key challenge for me to manage a skin infection is to deal with recurrences, which are such a common problem with MRSA skin infections. And we don't have good data to tell us how to interrupt the cycle. We really need studies to help us understand how we're supposed to break the cycle of recurrent infections in the skin setting. For more invasive infections, to me, the biggest challenges are understanding how long to treat and dealing with the limitations of our current antibiotic regimens, which really all have limitations. And so we need studies that tell us how long to treat various forms of invasive disease, and we need development of new antibiotics that deal with the inadequacies of our current regimens.
The key challenges in managing a patient with MRSA infection are what I broadly describe as staging, where you are with the disease. How complicated is it? Are there metastatic foci of infection? And making sure that those have been eradicated. And then secondly, the challenge of working with the drugs that we have now, which in many ways have important blemishes as potent therapeutic agents.
The key challenges, I think, in managing patients with MRSA, I think first and foremost is to get clinicians to appreciate it and think about it initially in empiric therapy, given that it's an emerging pathogen. I'm still surprised at how many clinicians still don't provide coverage for MRSA in empiric therapy, both in community and hospital settings. But once you get beyond that and you've identified MRSA, I think being able to identify factors, either host factors or pathogen factors, and that may include susceptibility profiles, identify those patients at high risk for problems to which we need to be more aggressive therapeutically with antibiotics, perhaps with other combination therapy. And I think finally, to understand that MRSA infection may not just be a medical disease, that frequently it requires both a medical and a surgical sort of dual combination approach, and understanding when is the right time for surgery, if surgery is indicated. I think that's difficult enough that going forward that it presents clinicians significant challenges.
I think the key challenges that we face in our patients with MRSA infections are identifying and assessing the extent of infection in our patients when they initially present. So making sure that we don't miss a patient who might present with a skin infection but really have complication of bacteremia or endocarditis, and that we do an adequate diagnostic evaluation. We ask the lab to perform susceptibility testing for us and make decisions appropriately about the need for antibiotics and then the appropriate antibiotics and setting for treatment in the hospital or at home.